The mantra in sports medicine is exercise is medicine. Everyone knows that exercise is good for them, but the question is, how do you get started? How much is enough? We know that exercise improves cardiovascular fitness, and more importantly, it can prevent and treat a lot of chronic diseases such as high blood pressure, stroke, diabetes, obesity, osteoporosis. The list goes on and on. There are 5 types of exercise, believe it or not. Number 1 is general activity. I get a lot of patients who tell me, well, I mow the lawn for exercise, or I do gardening, or I have 3 flights of stairs, and that's good. We want you to be active, but that's not quite enough. Number 2, cardiovascular exercise. Most people know the definition of this. It's usually in the form of running, walking, jogging, hiking, basically getting your heart rate up enough that you can still talk to a person, but you're not so winded that you can't speak. Number 3, resistance exercise. Most people know that some form of weightlifting to strengthen their muscles is a good thing. And resistance exercise really comes in 2 forms, either in the form of weightlifting like we talked about, and it doesn't have to be where you get big and bulky. It can just be light weights, multiple reps. And the other form, for those of us that maybe don't want to go to the gym or don't want to lift weights, is just with resistance bands, and you can get those at any local store. They're kind of a stretchy rubber material, and you can attach those to door frames or stationary objects and just use those as a form of resistance. Number 4, balance. Balance is really important, particularly as we get older. I know a lot of our patients come in saying that they're afraid to fall. And the best way to decrease the risk of fall is to exercise. And one of those types of exercises I just mentioned is balance exercise. There are really easy ways to do that. One is literally just to stand on one foot and balance yourself up against a countertop or a chair and try to go a little bit longer on that one foot every day. That's a static exercise. You can then move to a more dynamic balancing exercise where maybe you're jumping from one foot to the next. Number 5, flexibility exercise. This is extremely important. We know that as we get older, our muscles and our connective tissues get stiffer and they get dehydrated. So it's really important for us to stay flexible as we get older. And there are a couple of ways we can do that. There's static stretching, where you just, for example, bend over and stretch your hamstrings. But there are also other ways that we can do that where somebody helps us stretch, or we put a leg up on a table and do a more active type of stretch. This should be done at least 2 days a week, even on the days where you're not doing any of the other exercises we just talked about. I get a lot of patients who ask me, how much should I exercise? And as a general rule of thumb, the recommendations are this: 5 days of moderate intensity exercise for 30 minutes at a time. If you don't want to do moderate activity, which would be like a brisk walk, you want to get your heart rate up even more, we recommend at least 3 days a week of vigorous exercise. We also recommend 2 days of strength training, like we've previously discussed. Of course, there are a lot of people who want to do both. They want to do some vigorous activity, but they also want to strength train a couple of days a week, and we certainly advocate for that. If you want to start an exercise program or ramp up your activity level, the first thing you need to do is talk to your doctor. We have a lot of recommendations for people who have chronic diseases and for those who maybe are completely healthy but just want to get more active. One of the things we do recommend is EKG or stress testing in men who are over age 45 or women who are over age 55, and those who have chronic diseases like diabetes, where they may have some risk factors that require them to be supervised by a physician while they're doing their exercise program. Certainly there are contraindications to starting an exercise program, and those would be a recent heart attack, unstable chest pain, uncontrolled high blood pressure or uncontrolled diabetes, somebody who's just fallen and it's unexplained, it's not just a simple trip over something, or anybody who has EKG changes. So those are contraindications to exercise. You certainly need to talk to your doctor before you start any kind of a program. In closing, sedentary lifestyle is the most modifiable risk factor for chronic disease. So get moving. Even if it's just walking to the curb to get the newspaper, get up and get moving. This is really important for your overall health, not just physical, but mental and emotional. We know that cognition is improved in older individuals who exercise regularly. We also know that there's less anxiety and depression across the board in people who exercise regularly. And certainly, like we talked about before, the risk of chronic disease is significantly reduced with regular exercise. There have even been studies that have shown that exercise decreases risks of certain types of cancer, like breast and colon cancer. So again, I encourage you to get out and move, and remember that exercise is medicine.